A patient with Crohn's disease has purple color skin lesion near the ileostomy site. What is the most likely diagnosis? Here the options. Options are pyoderma gangrenosum, pemphigus vulgaris, metastatic Crohn's disease, dermatitis herpetiformis, and bullous pemphigoid. So a patient who is suffering from the Crohn's disease and undergone a surgery for this condition, there was an ileostomy, but around the ileostomy there is purple color skin lesion. We have to find out the condition. So this is a ileostomy. This is an ileostomy, and we can see the around the ileostomy what's occurred. There is a purple color. This is the purple color lesion around this ileostomy site. So we have to know the name of this condition. In this picture also, here we can see this is an ileostomy, and the ileostomy side there are the pinkish or reddish area, and also there is some pus point also present around this ileostomy site. And the condition which is the pyoderma gangrenosum, this term which is the pyoderma gangrenosum, it may occur in the case of the Crohn's disease. So in case of Crohn's disease, pyoderma gangrenosum, in case of Crohn's disease, pyoderma gangrenosum may be developed. And cutaneous involvement of the granulomas, that means the granuloma which involve the surrounding skin of the ileostomy side, especially in case of Crohn's disease. So in case of Crohn's disease, this pyoderma gangrenosum may occur, and their metastatic Crohn's is recognized. That means it is usually metastasized from the Crohn's disease, but it is very rare and less likely occur. So this is and good news for all the patients that the pyoderma gangrenosum it is not very common. Now see the stoma, which is maybe ileostomy or colostomy. We seen the ileostomy in previous two picture, but the stoma may be colostomy, may be ileostomy, may be temporary, may be permanent. In case of temporary, after few days or after few months, it is the colostomy or ileostomy reversal done. And the temporary or defunctioning stoma usually fashioned as the loop stoma, and ileostomy is spouted and colostomy is flush. So this point also important. Ileostomy is spouted to prevent the skin irritation from the small intestine content. On the other hand, colostomy usually not required that type of the precaution for this condition. It is flush type. Ileostomy effluent and usually liquid as it is the enzyme content, but colostomy effluent are usually solid. Ileostomy patients are more likely to develop fluid and electrolyte problems because the small intestine it contains more fluid, more electrolyte, and more enzymes. And for as they contains more enzymes, so it is irritant, and also there is chance of development of the skin irritation. And ileostomy is seated usually in the right iliac fossa, and colostomy usually seated in the left iliac fossa. This is some important complications of the stoma, including the pyoderma gangrenosum. First of all, here you can see this is the skin irritation, and the skin irritation is the most common complication of the. It is the most common complication of the stoma. Then prolapse may develop. That means the content within the abdomen may come out. Then retraction also occurs. That means what the portion we give exterior, it may enter into the abdomen again. Then ischemia. Ischemia is the most early symptom. It is the most early complication. So this 2 point is very important regarding the MRCS exam. Not only in MRCS exam, but also the different type of the exam. That means skin irritation it is most common, but most early it is the ischemia. Then stenosis may also be developed. Parastomal hernia may develop. Bleeding and fistulation also may occur. So again, the complication, the most common complication is the skin irritation. It is one of the important question in MRCS, and the most early complication is the ischemia. It is also another important question. Now see the skin irritation, which is the most common. Here we can see this is the most common complication regarding the stoma, and it is more occurs in case of ileostomy. Why ileostomy? Because the content of the ileostomy is liquid, it contains more fluid and electrolyte, it contains more enzyme, and we know the enzyme usually destructive, that means it destroy the surrounding structure, and when they come contact with the skin, they causes irritation of the skin. High risk, who are the high risk? Poorly seated stoma, non-nipple ileostomies, poor fitting appliance, and high output stoma. So they are the risk factor for development of the skin irritation or rash. So in case of a Crohn's disease, purple color skin lesion near the ileostomy, which is the pyoderma gangrenosum. And always remember, in case of Crohn's disease, there is a chance of development of the pyoderma gangrenosum. So any question who denotes that in case of Crohn's disease, so first of all you should keep in mind that it answer goes to the pyoderma gangrenosum.